The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Well, this is a great morning. It is Saturday, April the 7th, with all these women. You know, Dr. Mencia is a very interesting man. I don't know what happens, but when he comes, we have all these women sitting in this studio. I know he loves it.
But when I bring the guys, then it's your turn.
Dr. Mencia.
Today is my word.
Yeah, but you know what? You're here, so we all enjoy
We got
you.
Leah Hope with us.
Yes, we have Leah Hope Becker, but we have someone from your wonderful office. Why don't you introduce her?
Jennifer. Dr. Gillette is our psychologist. We have spoken so much about our psychologist. Why don't you introduce yourself?
Well, good morning. I'm very excited and happy to be here. Dr. Jennifer Gillette, a neuropsychologist. And so I am a clinical psychologist as well as a neuropsychologist with specialized training in the brain-behavior relationship.
Brain behavior. You know, it's interesting. Lately, we hear the word plasticity, which is so new in a sense. I mean, we had an author actually from some university, and he wrote wonderful. The Brain That Heals Itself was the name of the book. A brilliant man, and that's when I first heard about brain plasticity. Mm-hmm. Why don't you explain a little bit about what you do for Dr. Mencia's office?
Well, I do a lot of neuropsychological testing, and what that does is provides more detailed information about what a patient is experiencing and allows a physician to fine-tune their treatment plan.
Well, Dr. Mencia, you know, we've talked about this before. When someone comes into you and they're coming in for a physical, you often observe things way beyond what they came in for, don't you?
Absolutely. Well, you know, my field before becoming an MD was psychology. After I got my degree in psychology, then I went on to study medicine. And when I'm teaching the students from Nova University, FIU, FAU, all of the universities that I teach for, and the student come and rotate with me, I tell them from the moment the patients start walking into the exam room, I'm already examining them. Saying how they walk, how they talk, their behavior. Because sometimes there are certain things you want to say to the doctor, maybe on the first interview, but there are other things that you feel that the doctor is not interested in, and you hold them back. And I try to pull those things out if I think it's important for the wellness of my patient.
You probably say, what did you have for breakfast today, right? I can hear you say that.
Yeah. Or how they speak. So, the other day we had one of my patients from Germany, and as he was speaking, his thyroid was much larger on one side of the neck than the other.
You observed that?
And I said, well, have you ever had a thyroid test? And that came out of the left field. He said, no, Dr. Mencia, very stoic man. And, no, Dr. Mencia, never had a thyroid test. I said, your thyroid seems to be a little bit enlarged. He said, you know, in Germany, when I was a kid, they used to put iodine ointment on my neck so we won't get sick. And I said, really? Okay. So we did the ultrasound. Lo and behold, not only he had the nodule I was visualizing when he was speaking, but he has a huge nodule behind that one. Thank God after we did all the tests, iodine uptake and everything looked benign. So it's what we call a simple benign goiter, and we just monitor that. But he didn't even come for that to my office. And the same thing when they come to see Dr. Gillette. They might come in feeling that they are losing their memory and they are scared, or their loved one are scared that they have Alzheimer's. But when Dr. Gillette does her assessment, and she can speak more about that, she can dissect the mental condition of what's going on, and it might be more of a depressive episode probably related to stress or to pain or to something else that is mimicking an Alzheimer picture. And those patients don't need to be treated for Alzheimer.
You talked about that before, about people being over-medicated or on the contraindicated medication it's working against.
Exactly. So, a lot of medications that we take, if they can cross the blood-brain barrier, they will affect behavior and will affect your mood. And it will make you, sometimes will make you even behave as if you are schizophrenic, when in reality you are not. It's a side effect of the drug. So once I do my part of cleaning up the patient, quote unquote, cleaning up from all the junk med they are taking, and then Dr. Gillette step in, and she does her full assessment and spend a whole hour with the patient, trying to get a full picture of what's really going on in there.
Well, Dr. Gillette, what made you go into this field? I mean, there are a lot of fields you could have done as being a psychologist.
Initially, I was doing marriage and family counseling at the master's level, and I started seeing a lot of military families and guys coming back with mild brain injuries, and I wanted to try to find out more about what was going on with them emotionally versus what their brain injury might be causing. And that caused me to go back to get my doctorate in neuropsychology, because I wanted to not only be able to help people with their emotions, but I wanted to know what kind of brain impairments or brain disorders might actually cause emotional difficulties as well. And
go ahead. That's very interesting you were saying that. And the reason I didn't mean to interrupt you, but there are people who everyone will say they're bipolar. That is just the term.
Right.
And I know you came to probably talk about Alzheimer's here, but can you just take a minute and clear some of this up for a lot of us? What actually is bipolar, and is it something we can help, or what do we do with it?
Well, there's a couple different types of bipolar, and you're right. It's a term that's used very loosely nowadays, similar to ADHD, I would say. And really, if it's a depression that may have manic episodes, it may have mild manic episodes. Sometimes, teenagers who are just, sort of acting as a teenager might, they are termed bipolar because they might have, they might be a little bit more risky or a little bit more impulsive, which is something that is pretty common in adolescents or teenagers or young adults, and so they're sort of labeled as bipolar because they might be doing something that's just a little bit more age appropriate, I'd say. I call it age appropriate because, their frontal lobe isn't completely developed until they're in their early 20s, so that's not uncommon for them to not plan ahead or not think about what consequences might be because that part of their brain just isn't fully developed. And unfortunately, if they're sort of doing something that might be risky or impulsive, then they might be termed bipolar and then treated inappropriately for that disorder.
I was just going to say that, but now even talking about people in their 30s and 40s and 50s, it's the treatment, it's the medication that really often is not given correctly and really can set that person down in a very bad track.
Well, imagine if you don't, I'm so blessed to have Dr. Gillette in my practice. If you do not have a psychologist with you, and I guess my background also helped in my care of my patient when I'm seeing the patient personally. But when a person gets labeled bipolar, you carry that label for the rest of your life.
Really?
And it's so hard sometimes when I see a patient, they say, oh, I'm bipolar. And they've been taking an antidepressant. I say, well, that's the only medication you take? Yes. Do you feel depressed now? And I had a patient on 25 milligrams of Solo, which is a baby dose. And she was 34, mid-30. And I say, how long you been taking this? She say, since I was a teenager when I was diagnosed of being bipolar. And I say, well, I want to do something. I want to taper you down, and these are the signs and symptoms you're going to look for. And you're going to call me immediately if any of them start coming, like if you feel suicidal, if you start feeling sad, you cannot sleep. We went to all the signs and symptoms of depression, which is what Soloff can treat. It doesn't treat bipolar. And lo and behold, she came off the medication. And then I told her, because I said, sorry, now we have to empower her that she's as normal as anybody else. And this is a woman that already went through a divorce because the husband was on her way. You are bipolar. Everything you are doing is because you are bipolar. And she ended up at 34 in a divorce. And I said, now we have to empower you. So I say, we need to get you now to see the psychologist so she can work and help you with the behavior.
That's so. I know you're shaking your head, Dr. Gillette. So that sounds familiar, doesn't it?
And this is also very common in a elderly or older adult population who might be experiencing some symptoms of memory loss. They may think, "Oh no, I'm going to get Alzheimer's," or I'm having memory loss, and they start thinking the worst when in fact there could be so many other things that are causing that memory loss. It could be medication side effects, it could be vitamin deficiencies, it could be insufficient or inefficient sleep or sleep apnea. There could be so many other things that are causing that memory loss. Stress can certainly cause memory, inefficiency. Anxiety, depression can also cause memory difficulties. So really looking at all of the different things that could be contributing to memory loss and treating those things, and then really doing a full assessment and saying what's really causing your memory loss here. Is it more attention and concentration difficulties, and is there anything else that's going on? And a lot of times, as Dr. Mencia mentioned, depression can often look like dementia, but it really isn't a dementia. It's actually depressive symptoms, and those kinds of pictures will show up very differently on a neuropsychological assessment.
Well, we've been talking about assessments.
Mm-hmm.
What actually occurs in an assessment? Should someone be nervous or afraid?
No, not at all. Not at all. We may start building blocks. We may do vocabulary words. We may do some processing speed, so how quickly you might be able to do a puzzle or a maze. So there's just different types of tests that work the different parts of your brain. So I'm going to do several different tests that are going to help work the different parts of your brain, and I'm going to look at the patterns of how your brain is actually working. Where are your strengths and where are your weaknesses? All of us have strengths and weaknesses, so I want to look at your strengths and weaknesses and make sure that they are within the normal range. And if there are certain areas that are not within the normal range, then we can say, based on this pattern analysis, it may look something like this, and then provide that information to Dr. Mencia.
So that's where then we start to think, is this an organic brain dysfunction, or is it just something else that you have to deal with?
Absolutely. And you don't want to treat an organic brain dysfunction or treat something else when it could be something completely different. So when you do a very thorough assessment and rule out everything that could be possibly contributing to that, then you can really treat the patient appropriately.
I want to make sure that I let everyone know, if you would like to have an assessment, if you are worried and you want to meet with Dr. Gillette, would you please call 954-489-1345. That's the magic number, 954-489-1345. That will get you to the Adult and Geriatric Medical Center, and that's on East Commercial Boulevard in Fort Lauderdale. And I just have to tell you, if you have been listening for a while, and I hope you have heard so many experts here that Dr. Mencia, I don't know, he must have a cave there, and he just keeps bringing these people out. They're the most wonderful people. We've had Dr. Coleman with the hormone replacement, and we have had, of course,
Nicole.
Yes, Nicole with, the nutritionist dietitian. And then, of course, we've had your podiatrist. And
Dr. Joseph.
Yes, is it Joseph? Dr. Joseph?
Mm-hmm.
And, of course, Dr. Mencia's wife, who is Dr. Rosemary, the best dentist. I hope I haven't forgotten. I know there's been more people, too. But anyway, it is just such a pleasure to be able to talk with people like you. And it must be great to have this team approach for you, Dr. Gillette.
Absolutely. It's outstanding. I feel very, very privileged to work for Dr. Mencia and be a part of that interdisciplinary team and have all of those experts to be able to, refer to when trying to do what's best for our patients.
You know, Dr. Mencia, we talked about just people labeling you with something. I think a lot of people are being labeled with Alzheimer's disease the same way.
Of course. Yeah, of course. Without any testing, there's no testing done. You know, if one of my patients that went to see Dr. Gillette, they say, I never have anybody do this kind of testing on me. Not even you. I said, well, you know, I'm not a full-blown psychologist. This lady, she's a doctor in psychologist. I'm not. You know, I just got my little BA inside. But absolutely, and one of the things the patient like about Dr. Gillette is they know that with her they won't expect to get any kind of prescription. She will work with you, and for those people that like to be treated without medication, this is the way to go. The other thing that is important for our audience to know, that the center that for which I'm the medical director of does not require that you see me to see Dr. Gillette or Nicole or whoever you want to see, or Dr. Joseph. You can call the office and make an appointment and say, I just need to see the psychologist. You know, you might have an excellent primary care physician that you are very happy with, but you feel that you want to see Dr. Gillette to work with you. You can definitely call in and make an appointment with her. And if any of the other services, it's like going to a restaurant. Mm-hmm. When you go to a restaurant, you open the menu and you pick what you want. Nobody can make you eat soup if you want salad. So you pick exactly what you want. You might want to say, let me see Dr. Gillette. I want to see the dentist, and I don't want to see anybody else in the center. That's fine. You are not forced to go through the whole process.
I'm glad you brought that up. You know, so in other words, if I want to just go to the podiatrist,
absolutely.
Dr. Joseph, I make an appointment with the Dr. Joseph, or if I just want to see Dr. Gillette, even though, in a sense, while you're there, I think it's good to have someone kind of look at you on an overall basis, isn't it?
And we are always there. I have patients that they go to the dental department, and they get seen at the dental department. They are not even my patient. But the dentist will ask the patient, you know, I'm concerned with your medication and all of that. Before I even touch you, can I have one of the physicians see you? That's the beauty of being in a freestanding dentist or a freestanding psychologist versus a psychologist who have access to a full-blown lab, and you say, well, I want Dr. Mencia or somebody here to check your vitamin level. Not only she will get the result of the vitamin level without any cost to the patient, but then Dr. Gillette have me as a backup to say, can you go over this and explain to me what is it that we are seeing here? And then when she goes back to the patient is getting the best assessment possible. We also have the neurologists that work with us. So if you look at a memory center, people that go around saying, oh, we have an Alzheimer memory center. We are a memory center. We have all the ingredients. We are more than most memory centers, because if you go memory center by memory center, they do not have a geriatrician. Usually memory centers are composed of a neurologist and a neuropsych. Here you have the neuropsychologist, the neurologist, and the geriatrician. You have all three components that can put the pieces together, because the medical component is so important. And when I lecture a lot to neurologists. I lecture a lot to primary care physicians. So bringing the three components together and putting the medical component into it is, to me, is a complete memory center. We don't want to be labeled memory center.
No, but I have to add to what you said. I took my mother to a memory center. It's many years ago. She passed away 15 years ago. But they didn't have and it was a very fine one of the hospitals. But you're right. They had people just dealing with memory, where my mother really needed someone dealing with her medical parts because they over-medicated her, and I didn't know it. They said she had Alzheimer's with Lewy body, and the medication that they gave her caused her to go into quite a, I would say, vegetative state, which then she wound up, because she didn't move around, she wound up with ulcers, body ulcers.
Right.
So I have to tell you, what you said is brilliant. Go to someone where there is a medical doctor to oversee what's happening.
Yeah, because it's
Absolutely,
only
Dr.
so much the
Mencia.
neurologist can do, and it's only so much the psychologist can do. And then, but when you put the neurologist, the psychologist, and the geriatrician, you're getting a full. Yeah, exactly.
It is
It's a
perfect. Oh, I'm so happy, and I can understand, Dr. Gillette, why you feel so happy about this.
Absolutely.
When you were saying though, with the various testing, so this isn't something that people put little tubes on your brain or anything, right? These are
Not at all.
strictly words, and you go over, and it's more than what day is it, right?
Exactly, definitely. It's more than what day it is. And often an assessment will take several hours to complete. So not only will I do a thorough interview with you for at least an hour, sometimes two, but then we'll go on to the assessment of the different areas of your brain, and that can take another, 2, 4, 6 or more hours, depending on, what I think the patient can tolerate and how quickly you might fatigue. We might split it up into different days, but it is a very thorough assessment that really tells a lot about how your brain is functioning and helps really provide a good diagnosis.
Boy, I'm so happy that Dr. Mencia has just really jumped into this and has someone of your credentials. I want to remind everyone again, this is the wonderful world of wellness, and that's what we do here. It's really exciting. The phone number to call for an appointment is 954-489-1345. Medicare and most insurances are accepted. Call for an appointment. It's called the Adult and Geriatric Medical Center. It's located on East Commercial Boulevard, very close to Holy Cross Hospital. And I can't explain how wonderful all these people are, and I am serious about this. How do you wind up, Dr. Mencia, finding? Now, seriously, I know you're smiling. How do you find the quality, or are you do you have an opportunity for a lot of people, and this is the fine-tuning that we get here?
Exactly, yes. I do interview a lot of individuals. I'm very happy to have served the United States in the military. Dr. Gillette is presently serving.
Wait. What?
Yes, she's in the reserve, right?
Yes, the Air Force Reserve.
No way!
Yes.
Wait a minute. We should have said that at the very beginning. Air Force Reserve?
Yes.
No kidding.
Yes.
Yes, absolutely.
You are really something. Well, isn't that fantastic? Well, we wanted to be proud of you. See, that's even different.
Thank you. I didn't know you were going to bring that up today, Dr.
Yes, of
Mencia.
course. That's something that makes me very proud.
Yes, very,
Yeah,
very
me
proud to
of her.
serve. Absolutely.
In the Air Force, no
Reserve.
less.
Yes.
Will in the front, the concierge.
Yes. Oh my, I love
Will,
him.
he just retired from the Air Force.
Yes, absolutely.
So to me, the military deserve people to open the door for them. So that was one thing that definitely, when I saw her resume and all of that. And then when I met her, she was so friendly. She was a team player because they are neuropsychologists.
And beautiful. He's not going to say that, but I'm going to say it.
She's beautiful.
Okay.
Thank you.
And, they are dietitian, neurologist, podiatry, but they cannot be a team player. Those, they are people that, and I have interviewed already other psychologists, but they have worked by themselves all their life, and when you try to see how they can be part of a team, that was like, hey, no, I need my own space, my own thing, I do my own, I said, well, we need to be a team, we need to talk. So
that's where your psychology background comes in, because then you say, aha, not for us.
Yes.
But I do have to tell you, I
so
don't know.
we kiss many frogs.
Yeah, you kiss many frogs. I love that. Well, I don't know why you went in the Air Force, but it's time for me to give a plug for my husband. He was a B-17 pilot and flew 35 missions.
Fantastic.
Yeah, that's very
fantastic.
important.
That military background, it does help you and sort of develop you as a team player, and it also gives you a lot of attention to detail. You're very particular, and you have that training to always look for every detail and not miss anything. And I think that training, has served me well.
And she's so good that when I even steal a chocolate from her desk, she knows.
That's good. She knows what's going on.
You went through my desk.
I find the wrapper coming out of his pocket. That's what it is.
Well, in the time, we have about 2 minutes left, but maybe you can do this quickly, Dr. Mencia. It seems that all of a sudden the brain has really come to the forefront. I mean, we always knew we had a brain, but it was kind of not discussed.
The brain should be considered on healthcare as the center of the universe. If you imagine the brain touches every organ of your body. It influences every organ in your body. If you take the brain and its component, the spinal cord, and then all the nerve coming out, you get people out there thinking that they have asthma when it's a psychological condition. You get people out there thinking that they have irritable bowel syndrome when in reality it's a psychological condition. You get people thinking that they are constipated when they have a psychological condition. You get people thinking that they are having a heart condition. And in reality, what they have is a psychological condition. You know, I'm amazed in a country that is saying that they are trying to save money, and they don't put the emphasis on people like Dr. Gillette that could bring so much benefit to healthcare. You know, just go around and find out how many doctors has a neuropsychologist in their office working with them to help you minimize the amount of medication you are taking.
It's
amazing. The brain is very, very powerful.
Well, we want to thank you all very much, and we appreciate it. We will certainly have Dr. Gillette on our television show, yes.
Absolutely.
We'll have a little brain. That's what we'll have in front. We'll talk about the brain.
I can't wait.
Oh, yeah, no.
With all the lights.
Yeah, maybe have a brain that's in formaldehyde or something, right? Anyway, sorry. So bad. We need Einstein's brain. I think they do have his brain, as a matter of fact. I read it somewhere.
I just bought it this
With that, we're going to say adieu. Okay, and Dr. Mencia, 954-489-1345. Thank you very much, and we will go to our next guest after we have a commercial.